When I did my undergrad, I realized the wealth of information I had learned at Cedarville and the biblical base that it gave me for dealing with tough things. Cedarville really gave me a good base to learn how to react to people's needs and to how to meet them, their spiritual as well as their physical needs. And it continues on in the master's level as well. Not a lot of other universities offer that same approach, and it's one that I found very valuable with my practice. I really like the support that I get, not only from my fellow classmates, but also from the professors and their interaction that I get to have with them when I meet for them in class or some even online. But it's been great interaction and great support. Some of the nurses that I work with in the area hospitals say that they've always noticed how the Cedarville professors always seem to have such a great connection with the students and always are mentoring and very encouraging. I personally have found that as a nurse myself. The Cedarville nursing facilities have been known throughout the area as having very high-tech equipment, simulation labs. They even have a clinic that looks and feels just like a real doctor's office, which is what, as a family nurse practitioner, one of the areas that I could be practicing in. So it's very real. So we get to actually practice with some very live type equipment and develop our skills, listening to heart murmurs, listening to abnormal lung sounds, even assessing bleeding or circulatory changes. And that's been very helpful as we learn to practice and take those skills out into the clinical site. They constantly are saying, okay, what is the most up-to-date information, so we're not going on something we may have learned 15 years ago and hoping that that's most current. But there's a lot of focus of evidence-based practice and making sure that we're going to be giving our patients the best care.